My name is David Siambanes. I'm a pediatric orthopedic surgeon at St. Joseph Children's Hospital. Cerebral palsy is a condition that affects the developing brain either by an insult or injury or a genetic mutation, usually before birth. And it results in a motor deficit or motor weakness and spasticity as the child grows. Cerebral palsy is a condition caused by multiple etiologies. The most common is prematurity. A premature child doesn't have a fully developed brain, which results in not only motor issues, but mental issues and various levels of retardation that often accompany cerebral palsy. So the more underdeveloped the brain is, the more likelihood that they'll have this condition. Other conditions that are include infection, such as meningitis, or a stroke. Even babies can have strokes, or even intrauteral can have a stroke, which results with cerebral palsy as the child develops. Making a diagnosis of cerebral palsy can be quite difficult. There is no diagnostic test. Most of the things that we use as orthopedists is developmental milestones, meaning I'm watching the child sit when he's supposed to, crawl when he's supposed to, walk when he's supposed to. And typically it's hard to determine that the child has at least a mild level of cerebral palsy until about age of 2, because we're expecting them to make these milestones, and if they become more and more delayed, and I start seeing some increased tone on exam, then the diagnosis becomes more obvious. So cerebral palsy, we can divide it up in different types of methods. One type of cerebral palsy would be considered anatomical, meaning does it involve one side of the body, which we would call hemiplegic? Does it consider the whole body, which is quadriplegic, with a child who's much more involved, or just the lower extremity, which is diplegic? Cerebral palsy is a wide spectrum condition, meaning that you can have minimal involvement, such as a kid who just toe walks on one leg but has normal motor function otherwise and has normal mentality and cognitive value interpretation otherwise. It can go to the other extreme measurement, where the child is very cognitively impaired, wheelchair bound with high contractures and spasticity, which really cause discomfort and difficulties with quality of care. However, the two biggest conditions that arise with their quadriplegic condition involve the spine and the hips. The severe contractures around the hips cause the hips to slip out behind the hip. Initially, that is not always painful. Eventually, however, that can become severely painful, limiting their ability to sit properly, which is their only way to be transported. So for pain and for needs of transportation, hip surgery is often required. Another condition that often affects the child with quadriplegic cerebral palsy is scoliosis. Now, typically scoliosis in a normal child is considered idiopathic scoliosis, and it progresses and causes pain and deformity. Unfortunately, the child with neuromuscular scoliosis often progresses much more rapidly and much more severely. And this can affect the child's ability to sit, can cause pain, and even shorten the child's life expectancy if the curve becomes so severe that presses on vital organs such as the lung. It can actually cause restrictive lung disease as the curve progresses. So it's very important to intervene if necessary. The child who has cerebral palsy requires multi-specialty care. You can't be isolated to orthopedic or neurologic, so they need several specialists taking care of them. Usually there's a physiatrist that oversees their overall care, or a family med or primary care pediatrician. There's a neurologist, maybe a neurosurgeon is necessary, a urologist, an orthopedist, physical therapist, speech therapists. So it takes a large involvement of specialty care, likely under one roof, and likely these physicians are talking together for the child to get the most benefit, because they do have multiple needs. And these needs play on each other, and they do not work in one position isolated. There's a significant value to St. Joseph Children's Hospital in treatment of kids with cerebral palsy. And we have the ability to globally and comprehensively treat these kids with multiple specialties that are trained for children, with disabilities and impairments. We have specialty teams, we have specialty clinics, the Spasticity Clinic, the Gait Analysis Center. The Motion Analysis Center is very, very effective at analyzing these children in a walking state. If I was a parent with a child with cerebral palsy or other impairments or disabilities, I would feel very confident that I was getting the utmost and state-of-the-art care here at St. Joseph Children's Hospital.